This next video in our assessment series, we're going to be taking a deeper dive into how poor coordination and control of the muscles around the shoulder blade could be a root cause of your ongoing or chronic shoulder pain. If we look at the back side of the skeleton here in this still shot, we can see several light purple or dark pink muscles coming off of the shoulder blade in all different directions here. And this gray triangular shaped bone is our shoulder blade sitting on the back of our rib cage if we're looking at the back of the skeleton. Normally, there should be good balance and harmony between these different muscles here. If we pause it here, we can see this bottom muscle here attaching to the spine is a lower part of the trapezius. This upper light purple, dark pink muscle that comes off at the base of the skull and attaches to the outside of the shoulder is the upper part of the trapezius. And then we have this smaller muscle that sits into the groove on top of the shoulder blade, known as the supraspinatus, which is one of the four rotator cuff muscles. And then finally, we have another muscle that comes off of the rib cage and attaches to the inside of the shoulder blade called the serratus anterior. Normally, these muscles should work together in harmony in order to produce smooth and controlled movement, especially with any sort of overhead arm movement or with overhead lifts like the military press, incline bench press, or any of our Olympic lifts like the clean and jerk or the snatch. When there is an imbalance, which there's a lot of times an imbalance between the strength and control of some of these upper muscles in through here, like the upper trapezius and the supraspinatus, versus a lack of coordination, a lack of appropriate firing and force through these bottom muscles in through here. And what that can do is it can cause excessive elevation of the shoulder blade. It can create increased friction and inflammation in some of the structures underneath the roof of the shoulder blade, as well as around the shoulder itself. And over the course of time, if not successfully addressed, it can lead to structural damage and even cause tears in things like the rotator cuff or the labrum. As part of our powerful Triple R program, we're going to take a deep dive and perform a thorough custom assessment for you to determine whether or not this is one of the root causes of your ongoing or persistent chronic shoulder pain, and start to propose and work on solutions that get you real results to address this root issue for good.